Very true, sir. Actually, I was also influenced by my family members, actually, only, and it is the case of many students that they are influenced by their families and peers. Very few are there who are actually intrinsically motivated from inside to choose it. Sir, on a casual note, were you influenced by some crime investigation scenes or Dr. Saduki or something like that? Also,
No, no, no. I was just interested. I was not interested in this also, but I have to do the PG.
yes,
That
sir.
is the main thing. So, kisme kare, and I don't want to study another year, or because at that time there was COVID. So, if I had not taken any PG up during that time, then I would be 2 years late. And I just wanted to end this and start something new, or do something with my life, because it's been so long. I've been studying. Not, I cannot follow my passion or anything. I just wanted to settle. That's it. That's why I did my PG. If I had gotten not forensic, then I would have done another like that. But I didn't want any other things, because forensic was the branch. It intrigued me, because many few people take it and nobody knows what actually forensic is. Even I didn't know before taking PG. After knowing, I am spreading awareness regarding this about other people. To other people.
That's really great, sir. And sir, I would also like to know, according to you, what mindset actually suits this field the best, and according to you, which type of people should not choose this specialty?
It these specialties for people who have other passion. Apart from they have done MBBS, that's great, but they are not inclined toward going to the hospital, taking rounds, and treating patients, working in clinic, seeing OPD. There are many doctors who don't want to do this, but so that kind of personality can take forensic medicine, because the working hours are fixed, and after that they can do whatever they want to do. If they have any passion for singing, passion for dancing, passion for roaming and everything, they can do that. So first mindset is this, and second is it's a like not a high rewarding job. Like after completing your MD, you will earn around as an assistant professor, mostly from around 1.5 to 2.5 lakhs or 3 lakhs in some remote institutes like in UP and everywhere. But there is no guarantee that they will pay you, because they are for NMC inspection only. They will recruit you for NMC inspection, and once that over, it is not guaranteed that they will pay you. So it is like that. So you cannot open your own clinic if you want to, earn more and work more. Then this is not for you. This is for the people who just want to a 6 hour job, 8 hour job, and then they have their own life like that. And also being interested, if they are interested in solving crimes and other part of the medicine, then they can join government institutes also.
Thank you, sir. Next question was this only regarding the career and financial. Like, how is the career trajectory in forensic medicine in terms of the time and money, like from residency to assistant professor? Also, is there any room for private practice or medical legal consultancy? And how do the salaries vary across the government, private, and academic sectors?
So the main issue is कि in government sector you will get the same pay as all the clinical and non-clinical people. Like after completing your residency will be same stipend for all. SRship will the same stipend will be same for all. And then assistant professor, the stipend will be same for all as other clinical and non-clinical branches. But in private colleges there is a huge disparity, because there are very few forensic people. So you can get in a good salary like 2.5 times extra from the private government institute in a private institute, and you won't have to work any medical legal cases there also. So like if you want not to work in medical legal case and also on good salary, then you can join private institutes. Then you won't have to go to any courts, and you won't have to do any, if you're properly included in the teaching part, not in the practicing part of the forensic medicine, then this is best for you. Like I am also like only the teaching part of this forensic medicine, because in most institutes there is no proper area designated for the mortuary, and if they are designated, they are not properly maintained. So you have to build everything from the startup wherever you join. And apart from that, there the people are not educated about the forensic medicine procedure. So you have to convince them every time ki why the postmortem necessary, why we are preserving samples, and why we are doing this, and why is it taking so much time to get the report. Because once you send the report, then the FSL takes around 6 months. The histopathology takes around 1 year, and the court takes around 3 to 4 years to for summons. So if you have done a case today, then you will get summons after 3 years, 2 years, 4 years. This is how the Indian judicial system works. So you have to consider all these factors, and then you can decide whether you want to join in the private or in the government. Because if you join in the government institute, you will get less salary, but you will have a proper, circle of police, politicians, and other people who do cases that you come. So you get some extra perks from that because people will know you. So that's another thing. That's if you want the work satisfaction. But if you want the money, then you have to join the private institute.
Sir, can someone do like that? Do the government practice, and then there also he is doing some medical legal consultancy or some sort of private practice?
See, this medical legal consultancy is like in very infant, or I should say embryo or zygote phase in India.
Yes, sir.
It's because the Indian judicial system is very slow, and even the lawyers, they are not educated enough to ask questions, and the doctors who are doing postmortem, because most postmortem are done by MBBS doctors at PSC and CSC. In there are very few institutes where the forensic experts are present. So these doctors also don't know what to write, and the lawyers also don't know what to write, and the judges don't know what to see. So most of the time there is no scope for medical legal consultancy because whatever the doctors write, the lawyers don't ask any question, and that's just finishes everything. Because I have seen many reports by the medical officers and they are completely wrong, totally wrong. They have not mentioned anything, but still somehow it got accepted in the court because there is no proper training to the lawyers, not proper training to the police officer, no proper training to the medical officers regarding the forensic aspects or the medical legal aspect, how to write a post-mortem report or how to write an injury certificate and how to write everything. And the court accepts it, and this is how the Indian judicial system works. So there is very little, medical legal consultancy scope of medical legal consultancy in India, and because most cases are in the clinical part, the negligence which happens, they happens in the clinical part, and there is the medical negligence, and they are done by the lawyers only, and they argue each other regarding this and that about the standard of care, and that's it. So forensic medicine is like very in the embryo or zygote phase in India currently because there are no proper FSLs. There are very few FSLs, and they take around 6 months to 1 year to get a report. There are very few histopath labs. If you send the sample, there is so much workload. It takes so much time, and after that, judiciary takes so much time. So the crux of the case, like if you have done a homicide case today, you will get summons after 3 to 4 years. So what is the use of doing medical legal consultancy?
Very true, sir. Sir, what are the options like if after PG, if someone wants to do some sort of super